Thank you, Mr. President. Special thanks to Senator Capito and all she's done, not only in this area, but in so many things that affect rural America. Certainly being a co-chair of the Rural Broadband Caucus, again, the list goes on and on. So we do appreciate your leadership. Our nation's opioid epidemic is unfortunately a subject that we've spoken about all too often here and in so many other places. It does feel, however, that the tone and tenor of our remarks reflect a much more hopeful outlook that many of our previous discussions have had. That's because we are making progress in the fight. Around this time last year, we came together to overwhelmingly pass a comprehensive legislative package that was signed into law by President Trump. Democrats and Republicans working together. There's been a noticeable difference as a result of this comprehensive reform. Law enforcement is now better equipped to stop illegal opioids from reaching our communities, and efforts have been stepped up at the border to cut off the influx of fentanyl from China. More first responders have been trained to administer naloxone, which has prevented opioid overdoses from claiming more lives in our communities. Most importantly, we've saved lives by increasing access to mental health and addiction treatment services for those struggling to overcome opioid dependence. The treatment and recovery aspect of our strategy is key. Federal resources are being deployed nationwide to break the cycle of addiction. These grants are invaluable for the facilities that give those struggling with addiction and their families new hope in the fight against opioid abuse. From what I've seen firsthand at treatment facilities in Arkansas, these efforts are indeed making a difference, helping tremendously. The impact of this national epidemic has been felt acutely in the natural state. According to the CDC, Arkansas had the second highest prescribing rate over recent years, enough for each Arkansan to have more than one opioid prescription in his or her name. It's taken a conscious effort by the state's medical community to drive those numbers down by 12% over a 4-year period. Limiting the amount of dangerous pain pills in circulation is a very positive and much-needed step. But what about all the expired, unused, and unnecessary medications already in circulation? That's where Arkansas Take Back comes in. Arkansas Prescription Drug Take Back Day events happen twice a year at locations across the state. These events are an opportunity for Arkansans to safely dispose of unused or expired medications with no questions asked. They also serve as an opportunity to further educate the public on the opioid epidemic and the importance of proper disposal of medications. The 18th Arkansas Take Back this past weekend was another in a long line of successful events. According to Arkansas Drug Director Kirk Lane, over 27,000 pounds of pills were collected at the nearly 200 event day locations and the 200-plus permanent drop boxes across the state. These events are a heavy lift on the part of many Arkansans. We greatly appreciate the efforts of law enforcement agencies across the state, as well as their partners, Rotary Clubs, Prevention Resource Centers, Arkansas Department of Health, and so many others to carry out Take Back Day events. The hard work to organize these opportunities to properly dispose of prescription medications is certainly worthwhile. Research has found that the majority of opioid abusers get their drugs from friends and family, often lifting pills from a familiar medicine cabinet. When you tally up the results from the previous events in the state, Arkansas ranks third nationally in pounds collected per capita through Take Back. That means there are fewer homes in Arkansas where unsecured medications can get in the wrong hands. I'd like to thank my colleagues who are sharing similar stories, success stories from events in their states. It's important that we highlight these programs. Anything we can do to get these dangerous drugs out of circulation certainly can help save lives. It's also a valuable reminder that we will all have a role to play in the fight to end the opioid crisis. Prescription drug take-back is an easy way. Each one of us can certainly do our part.